Today we are going to discuss about alcoholic liver disease. Okay. See, if a person is taking alcohol, will his liver damage immediately? No. It will progress through some stages. It will not damage at a time. It will progress through some stages, and that stages we'll discuss now, and the definition of alcohol liver disease, and what are the pathogens, what are the etiological agents, how it happens, what is the morphology, what is a microscope, we'll discuss. Okay. See, first we'll know about classification. Why we should know about classification? It's not important here. If in the question if he asks, we can write, but we should know it. If we take morphological classification, if we take morphologically, it is micronodular and macronodular. See, if this is the liver, if the nodules are somewhat small, this is micronodular, and if these nodules appear to be large, it is macronodular. It seems silly, but it is the thing why the micronodular and macronodular name came. Okay. Micronodular is less than 3 mm. If these nodules are less than 3 mm, we call it what? Micronodular. If they are more than 3 mm, we call it macronodular. Okay. Then where we can see this? Micronodular is more common in our disease. Okay. In our disease, what is this? Alcoholic liver disease. In our disease, it is very common. Alcoholic liver disease. Now our point of interest is this one. Okay. And micronodular we can see in viral hepatitis. Okay, we can see in viral hepatitis. This is one of the classification, and second type of classification is based on etiology. Based on etiology means based on what, by which it is being caused. We can take alcoholic cirrhosis. See, now we are not discussing about alcoholic liver disease. In the micronodular pattern, we already got our what? Uh, we already got our disease name. So we are discussing some more classifications. Okay, means like this disease, other diseases we are discussing. This is our point of interest: alcoholic cirrhosis. In the etiology, in the morphology, we are interested with micronodular. Okay, in the second one, we can take biliary cirrhosis. Hmm? We can take biliary cirrhosis, and in metabolic cirrhosis we can take, and we can take cardiac. Okay, these are different types of cirrhosis, but we are interested now in alcoholic cirrhosis. Okay, we are done with the classification, and now we'll go with the pathogenesis. Okay, see, I will make it very simple. No need to remember anything, you need to understand. Okay, alcohol. A person is taking alcohol. This alcohol is entering the body. After entering, it is converted into acetaldehyde. Then it is converted into alcohol to acetaldehyde, acetaldehyde to acetate, then to acetyl CoA. Then after acetyl CoA, it will become CO2 plus H2O. Okay, this is the normal process if the person takes alcohol in limit. But if we take excess alcohol, what happens? This all process will be shunted. It will happen irregularly. So there will be accumulation of acetaldehyde. This is very toxic to body. Okay. One more. When it is converted from alcohol to acetaldehyde, here NAD is converted to NADH. Okay. Now our point of interest is this one, and this process, because these are what it is, detoxification methods, right? So we are not interested here. We are interested in the toxicity because we are talking about disease. Okay, this NADH stop uh, fatty acid oxidation. It will, this formed NADH will not allow the breaking down of fat. So what happened? Accumulation of fat. So the fat accumulated. Okay, here this is the first step. Means first we are talking about one thing, means overall we are talking about what happens, why the toxicity is created. Okay, in that first we saw accumulation of fat. Okay, good. In this process, while it is happening, an enzyme is activated, that is CYP2E1. This CYP2E1 activated, what it creates? It creates oxidative stress. It creates oxidative stress and it leads to liposomal peroxidation and kill cell. What happened here? Alcohol is converted to acetaldehyde. That means in that process, a protein or an enzyme is activated, that is CYP2E1. This CYP2E1 creates an oxidative stress to break down. So after to break down, it created, so the cell is killed. This is finished. Okay, this is also good. Then what happened? Due to this acetaldehyde, there are, see, in the liver, what are the modified macrophages in the liver? Those are called Kupffer cells. See, if this is the total liver and some cells we are taking, okay, this is the layer of liver cell, this is the layer of hepatocytes. Okay, both are hepatocytes. This is the one layer of hepatocytes, second layer of hepatocytes. In between this is called sinusoid. These are called sinusoid. Okay, in between this hepatocyte cell layer and this sinusoid, इस दोनों को बीच में एक गैप है. This space is called space of Dissay. Okay, the space between the hepatocytic cell layer and the sinusoid is called space of Dissay. What this space of Dissay contain? This space of Dissay contain stellate cells. Okay, our point of interest is also in the stellate cells. Remember this, I will tell about this next. First, in the sinusoids, there are modified macrophages known as Kupffer cells. Okay, there are Kupffer cells. What these Kupffer cells do? This will engulf the damaged debris, the destroyed RBCs, all debris it will be clearing. But as here toxic metabolism is created, here oxidative stress is there, the lipid what this fat is getting accumulated. So what happened? These Kupffer cells release some cytokines, that is tumor necrosis factor, interleukin 1, interleukin 6. Why it is releasing this all? Because already there is some ongoing inflammation. So ongoing reactions, ongoing cell death, not inflammation, ongoing cell death, ongoing fat accumulation. So what it does? It releases tumor necrosis factor, interleukin 1, interleukin 6 and some other cytokines. What these cytokines do? This take up inflammatory reaction. Okay, this is the cause of inflammation in the alcoholic liver disease. Okay, then what happened? Then we'll know about stellate cells. Okay, normally this stellate cells, See, liver has a normal architecture, right? Liver, it has a specific shape. How it is maintained? Because here in the space, or in the space, it releases fibers, collagen fibers, and it maintains the normal architecture. What? This stellate cells. Okay, stellate cells located in space of this will normal very small amount of structural material it will secrete and maintain the normal architecture. But when all this inflammation, cell death, this fat accumulation, all this happen, what it thinks, something is happening and my architecture is being damaged, cells lost, this lost fat is accumulating. So what it does, it transform into myofibroblast like a cell. It transform into myofibroblast like cell and produce, first it leads to fibrosis. Fibroblast cells, what did they produce? They produce actually means if they are produced in normal quantity, there will be extracellular matrix will be normally created. But if they are produced in excess quantity, it leads to fibrosis. Then to our point of interest, cirrhosis. Okay. Now we understood how cirrhosis happen, why inflammation happen, why fat accumulation happen. Okay, we all understood everything. So now we'll go with the stages. See, if you take a pen and paper and write along with me, it will be very easy for you. Very easy means you are not required to write again once more seeing the video. Now only you can write it while I'm saying. Okay, now we saw all the stages, right? We saw all the stages. Now we'll know, not the stages, how the mechanism happens. Now we'll know about the stages. Okay, first what we saw, fat accumulation. So fatty liver, this is the first step. Okay, what happens in the fatty liver? First we'll know about the gross. What is accumulating? Fat is accumulating. See, in the this one, fatty stools, how the stool will be? It will be greasy, right? So here also, due to accumulation of fat, the liver will be greasy. Okay, first point, greasy. And due to accumulation of something, it will enlarge. So second one, enlarged. It might appear slight yellow in color due to fat. Slight yellow color. Okay, these are the points we should write in gross appearance. And then, okay, I will write microscopy. I will write microscopy. See, I will make it very, very clear what happening. This is the liver cell, this is the nucleus, and now fat is getting accumulated. Okay, this is called microvesicle. What happened? Just a fat accumulation, and in the hepatocyte, that is called microvesicle. Then if more fat accumulate and the nucleus is pushed to periphery, what it is called? Macrovesicle. It is called macrovesicle. What if this big one is bursted and all fat is spreaded? It is called fatty cyst. Okay, very easy, right? First one, some fat deposition, it is called microvesicle. Some extra is accumulated and the nucleus pushed to periphery, it is called macrovesicle. And if it burst, it is called fatty cyst. It's very simple. And if you want to draw an exam, you have to draw all the cells and portal triad, you have to draw. Okay, I'm not drawing here, but you have to draw. But these are important. You have to write macroviscal and fatty cyst are very very important. Okay, first fatty liver is finished. Then we'll see hepatitis. Why hepatitis happening? Because of fat. So steatohepatitis. Hepatitis. This inflammation is happening because of what? Because of fat. So it is second stage steatohepatitis. First one is fatty liver. Second one is steatohepatitis. So in this stage, um, this is the liver, right? What I told about this stellate cells in the space of this what they produce if they convert into myofibroblast, they leads to fibrosis and then to cirrhosis, right? Okay, till this stage it will not come now, but what happen, it will not come to this is the next stage. But here what happen, if this is a liver and these are cells, we saw, right, this one, the hepatocytes are there. This is between space, and here there is space of this here. That one only I am drawing here. There are many spaces like this, but normally it will be normal, but here our point of interest is not normal, right? So we'll write fibrosis. This fibrosis will happen from center to periphery. This will happen from center to periphery. This will happen from center to periphery like this. Okay, as it is becoming center to periphery, it is called chicken wire fence pattern. Why it is called chicken wire fence pattern? If you see any chicken poultry farms, you can see nets like this. These are not box shaped, these are this. Okay, imagine this as like these shapes, not boxes. Okay, here if you keep a chicken, see in the center there is mass and to the periphery it is extending, right? So this shape is compared with this chicken wire fence pattern. This is the only reason it is told like that. Okay, in the steatohepatitis we can see chicken wire fence pattern, and one more is also there, that is, we'll draw and show you. See, this is the hepatocyte. Any cell will have not any cell in the cells in the body will have cytoskeleton. This cytoskeleton, due to inflammation, it will break. What is breaking? Cytoskeleton. Cytoskeleton is breaking and form bodies like this, inside the cell only. Okay, these are forming bodies. How they are? They are eosinophilic. They are eosinophilic stained. And where are they? Inside the cell. So intracytoplasmic bodies formed from the breakage of the cytoskeleton due to inflammation, and they have a name known as Mallory Denk bodies. Mallory Denk bodies, you should short write in steatohepatitis, that is Mallory Denk bodies, and chicken wire fence pattern also you have to write. These are the two important things we have to write in steatohepatitis. And one more important thing, that is, see, in the liver, what uh, these liver cells are there. Okay, these liver cells, before bursting out, before bursting, they will form like a balloon due to necrosis inside. Okay, they will be formed like a balloon. That means that their size will be increased. This is called ballooning degeneration. This is very important gross feature. Gross feature you have to show right in ballooning degeneration in steatohepatitis. What are all the 3 points we saw? Ballooning degeneration, malloriding bodies, and chicken wire fence pattern. Okay, we completed steatohepatitis. What after steatohepatitis? It is liver cirrhosis. Okay, in the gross, this is the liver. Remember gross like this only. I will explain after the microscopy so that you can understand it better. This is the microscopy. See, due to inflammation, due to that cytokines release, the cells are dying. Okay. After the cells are dying, what the liver thinks? Oh, my cells are dying. I should produce more liver cells. So what it does? It tries to produce more liver cells. It is trying to produce more liver cells. But our stellate cells in the space of decay already produced fibrous septa. Already produced fibrous septa in the space of decay. So what happened? The liver tries to grow, but it can't grow. Why? There is septa. Hmm? There is septa, so it can't grow. So how it is appearing? Isn't it appearing like nodules? And what is the size of these nodules? Less than 3 mm. What are these? Are they micronodules or macronodules? This is micronodules. We discussed in the starting, right? So they will appear in the gross like micronodular pattern. This should, you should surely write in gross. Okay, in the microscopy we are seeing fibrous septa, then we are seeing this. Okay, these nodules are what? After the liver tissue is being killed, the liver is trying to regenerate, right? So these are in the shape of nodules. These are regenerative nodules. You should surely write this regenerative nodules. These are very important. I told very clearly how these regenerative nodules are created and what is the reason behind why it is called regenerative, because it is trying to, the liver, the dead cells are, after the cells are dead, the liver is trying to regenerate. So this regenerate the first name. And nodules, why it is in nodular shape? Because in the space of disease, the stellate cells already produce the fibrous tissues and fibrous septa, so they can't grow more than this, so they appear like nodules, so it is called regenerative nodules. And one more, see, now the liver is having all toxic metabolites. Okay, so what liver thinks? I should excrete them in bile. But see, already now abnormal things had happened in the liver, then how normally the only single bile duct can take it? So there will be bile duct cell proliferation. The liver size is enlarged, so the taking, the outgoing also should be more. So what happened? Bile ductal cell proliferation. Okay, what we saw? Bile ductal cell proliferation. regenerative nodules, fibrous septa. These are very very important. Microscopic features, gross features. Okay, and these are all the important things. And there is a take home work. Okay, I want to make it more interesting so that you will read after the exam. So read after the exam. Sorry, read after the video. See, I will give clue also. There is a shoe. This shoe has like this structure. This is the what bottom of the shoe, and this pattern is described to this liver in the gross. Okay, pin in the comment what is this. It has a specific name. You comment in the comment section so that I can understand that you are following till the last of the video. And okay, even if you don't, I will tell it.